Almost everybody experiences a strain or a sprain from time to time, but most of the treatments that have taken place up to this point have actually been proven not to be effective in healing those injuries. We're going to take a deeper look into treatment of basic injuries such as sprains and strains. Welcome back to the channel. It's been a little while since we posted a video. We've had to take a break for various reasons, but we're back and we are ready to bring you some more regular content. So today we are going to be taking a look at some basic injuries. And these basic injuries, we're talking like a sprain, if you sprain your ankle or you injure your wrist, particularly these joint injuries. And we're going to be taking a look at some of the previous treatments that have been used for these injuries, why they may not be effective. We'll give some information on some research that's been done that shows some of these previous methods used are not the best methods to be using. And then we'll give you some alternatives that you can look at to be able to help heal faster and quicker some of these injuries. We are going to be talking about some medical treatments in this video. And as always, this is not medical advice. This is not me telling you how to treat an injury. This is for informational purposes only. There's been some study and research out there, and I want to share some of these new ideas with you. Make sure you do due diligence, do your research, go talk to other people, listen to other people. Don't just listen to one person on the internet. This is just some information I have gathered to be able to share out there. And I've also got some of the information that I've pulled this from in the description down below. So we're not going to be talking about any one specific injury, but a specific injury that is pretty common would be something like a rolled ankle, where you sprain your ankle, you stress or tear those ligaments that are holding the bones together in your ankle. But this can happen to a lot of different joints, and you can have other soft tissue injuries that also produce swelling and that may be treated along these same lines. So before we dive into the specific treatment, let's talk a little bit about what happens when you have something such as a sprain. So when we sprain a joint, we have damaged tissue. That tissue starts this unique process for healing at that area. One of the things that it does is it triggers a histamine release. Now, the role of a histamine is basically to increase inflammation. What it does is it increases the diameter of the blood vessels in that area of the damaged tissue. That allows properties from the blood to be able to leak into the surrounding cells. Some of those properties that are leaking through are things like white blood cells, which are responsible for getting rid of any unwanted bacteria and also healing properties to start healing some of that damaged tissue. Another time that you may have heard histamines or way that you may be familiar with them is when it comes to an allergic reaction or anaphylaxis. We start to get some of those hives on the skin. We may even have a worse anaphylactic shock. Now we have severe swelling of the airway, but all that is a histamine release that has triggered this swelling. And so now, on top of some things like epi, which we may have to do for a severe case of this, we also take Benadryl, and the Benadryl helps to keep that histamine at bay and stop that reaction to reduce some of the swelling in the body. Now, in severe cases like anaphylactic shock, our body has gone overboard in its fight against whatever that property was. Now we have swelling in an abundance, which now the swelling can be life-threatening. But other than these severe cases, typically, swelling is a good thing. Swelling means that our body is functioning properly. The histamines are allowing for that inflammation. The white blood cells are getting in this damaged tissue to be able to start rebuilding, repairing, and getting rid of any unwanted bacteria or things that should not be there. But when we look at traditional treatment of an injured joint that has swelling, typically we see this acronym called RICE that we are using to be able to treat these injuries. Now, RICE, R-I-C-E, stands for rest, ice, compression, and elevate. And every single one of those things is to eliminate swelling. Now, swelling can put pressure in that area and can cause some pain. So yes, RICE may be one of the best things we can do along with some pain control to be able to keep that pain at bay. But it's not necessarily the best thing for that joint. When we're resting, we're limiting the amount of motion in that joint. Initially, that can be a good thing to allow that joint to heal. But what actually helps that joint heal is some small amount of movement. So being able to move that joint early on is actually going to speed up the healing process because it now activates the lymphatic system, which actually helps with the healing and reduction of swelling in that area. The second thing in rice is ice, or something like these cold packs. You break them, pop them, they get real cold, you apply them to the injured area and they help reduce swelling. What happens is when we put something cold on an injured area, our blood vessels that have now opened up because of the histamines now actually shrink because they will shrink in the presence of cold temperatures. That's a normal response our body has. We apply ice, they shrink down, and we get less of that leakage through the blood vessels now because they're smaller and constricted down, not allowing white blood cells and fluid to be able to pass through that vessel as easily. So again, we're reducing that inflammation. The third thing in rice is compression. We usually take something like an ACE bandage or some form of compression wrap or compression sock or a brace for the wrist. And we put this on there and applies pressure. And what it does is it is limiting the amount of fluid that can leak out of the vessels because there's constant pressure helping keep that together. So now we have limited circulation in that area. And that circulation is what's going to bring good, healthy white blood cells to that point of injury to be able to repair that area. And we have limited inflammation, so the blood that does get to the area cannot leak through into the cells, allowing those cells to be able to rebuild and for that damaged tissue to be rebuilt over time. So the last thing in rice is elevation, and that is simply keeping that injured area above the level of the heart. If you keep it below the level, gravity is going to want to pull more blood down toward that area, and that gravitational pull can increase circulation in that area, which we originally thought was a bad thing, and we didn't want that circulation or that swelling in that area. Now, if you follow the rice method for an injury, you may get better pain relief right off the bat. The ice may start to numb the area that was hurting, and you're going to have less inflammation to push on nerves in that injured area. So initially, for pain control, rice may be the best method to be able to reduce the pain, but it's not necessarily the best solution for the fastest healing process for the body. I want to pause for just a second and say if you find anything in this video helpful, if you would leave us a like on this video, that would really help us out. And if you have any questions over the stuff we're going over or any other alternative thoughts or any other further research that may add to this discussion, if you would leave that in the comments down below, we'd love to hear from you. If you haven't already done so, subscribe to the channel and make sure your notifications are on so you get an alert when we post any future videos. In sports medicine and emergency medicine, and particularly physical therapy, and some of these fields that deal with some of these injuries, there's been a lot of discussion lately on using a new acronym called MEAT, M-E-A-T. And this focuses a little bit more on using movement and mobility along with some pain control to allow the person to get back to normal function and allowing the body to be able to do what our Creator designed it to do in healing this damaged tissue rather than constricting everything and limiting the amount of blood flow to this area. MEAT stands for movement, exercise, analgesics, and treatment. And so with the MEAT thought process, rather than constricting all this blood flow through the RICE acronym, we're now going to start, as soon as possible, starting to move that joint and work it back and forth without a lot of weight bearing. Then we'll slowly move into weight bearing and try to start working on getting more of that stability back. If it's, let's say, an ankle, we want to start putting pressure on that ankle at some point. Again, this is not medical advice that I'm giving you here to say, hey, go sprain your ankle and then go run around on it. This is just a thought process in this field of how we can help our body heal faster. So we want to increase the movement. We want to start exercising that joint to allow the body to increase blood flow to that area and to be able to heal that area. But we do want to think about pain control, because if you have increased pain, you're not going to want to move it. So analgesics and pain control, even if that's something as simple as Tylenol, that can be helpful to be able to manage that pain while you are letting the body heal itself, because we've taken away some of the ice and compression, some of these other things that normally were our form of pain control. If you have lasting problems or something that lasts longer than several days, you should definitely see a physical therapist or a orthopedic or someone that can take a look at these things. A big issue with joints is sometimes that not only will you strain or sprain that joint, but you may also have a fracture as well. So it's always a good idea to be assessed. They can do an x-ray to make sure that you don't have any severe fractures, because it's hard to rule some of those hairline fractures out without an x-ray. So as we conclude, I just want to recap a little bit. We have the RICE acronym that is all about compression and reducing inflammation in an injured area. But we've also seen that our body's natural response to be able to heal itself and to be able to heal this damaged tissue is through that inflammation. So we are now shifting in the medical field to allow the body to have that inflammation, managing the pain, and trying to get movement of that joint or injured area started sooner rather than later so that we can increase the blood flow and start to get some of that movement mobility back. I'm going to leave a link in the description down below of a physical therapist that put together some information on this. You can read further about this. They've got some good sources cited from some medical research as well at the bottom of their page, so you have some more resources to pull from. So this is not just coming from me, a random guy on YouTube that is saying some information out there. There have been a lot of people that have been looking at this in the medical field. All right, well, that's it for today. As always, stay vigilant and stay safe.